Can COVID-19 be caught from a person who has no symptoms? COVID-19 is mainly spread through respiratory droplets expelled by someone who is coughing or has other symptoms such as fever or tiredness. Many people with COVID-19 experience only mild symptoms. This is particularly true in the early stages of the disease. It is possible to catch COVID-19 from someone who has just a mild cough and does not feel ill. Some reports have indicated that people with no symptoms can transmit the virus. It is not yet known how often it happens. WHO is assessing ongoing research on the topic and will continue to share updated findings. What are the symptoms of COVID-19? The most common symptoms of COVID-19 are fever, dry cough, and tiredness. Other symptoms that are less common and may affect some patients include aches and pains, nasal congestion, headache, conjunctivitis, sore throat, diarrhea, loss of taste or smell or a rash on skin or discoloration of fingers or toes. These symptoms are usually mild and begin gradually. Some people become infected, but only have very mild symptoms. Most people, about 80%, recover from the disease without needing hospital treatment. Around 1 out of every 5 people who gets COVID-19 becomes seriously ill and develops difficulty breathing. Older people and those with underlying medical problems like high blood pressure, heart and lung problems, diabetes, or cancer are at higher risk of developing serious illness. However, anyone can catch COVID-19 and become seriously ill. People of all ages who experience fever and or cough associated with difficulty breathing / shortness of breath, chest pain / pressure, or loss of speech or movement should seek medical attention immediately. If possible, it is recommended to call the healthcare provider or facility first, so the patient can be directed to the right clinic. What should I do if I have COVID-19 symptoms, and when should I seek medical care? If you have minor symptoms, such as a slight cough or a mild fever, there is generally no need to seek medical care. Stay at home, self-isolate and monitor your symptoms. Follow national guidance on self-isolation. However, if you live in an area with malaria or dengue fever, it is important that you do not ignore symptoms of fever. Seek medical help. When you attend the health facility, wear a mask if possible, keep at least 1 meter distance from other people, and do not touch surfaces with your hands. If it is a child who is sick, help the child stick to this advice. Seek immediate medical care if you have difficulty breathing or pain / pressure in the chest. If possible, call your healthcare provider in advance so he / she can direct you to the right health facility. How does COVID-19 spread? People can catch COVID-19 from others who have the virus. The disease spreads primarily from person to person through small droplets from the nose or mouth, which are expelled when a person with COVID-19 coughs, sneezes, or speaks. These droplets are relatively heavy, do not travel far and quickly sink to the ground. People can catch COVID-19 if they breathe in these droplets from a person infected with the virus. This is why it is important to stay at least 1 meter away from others. These droplets can land on objects and surfaces around the person such as tables, doorknobs and handrails. People can become infected by touching these objects or surfaces, then touching their eyes, nose or mouth. This is why it is important to wash your hands regularly with soap and water, or clean with alcohol-based hand rub. How can we protect others and ourselves if we don't know who is infected? Practicing hand and respiratory hygiene is important at all times, and is the best way to protect others and yourself. When possible, maintain at least a 1 meter distance between yourself and others. This is especially important if you are standing by someone who is coughing or sneezing. Since some infected persons may not yet be exhibiting symptoms or their symptoms may be mild, maintaining a physical distance with everyone is a good idea if you are in an area where COVID-19 is circulating. What should I do if I have come in close contact with someone who has COVID-19? If you have been in close contact with someone with COVID-19, you may be infected. Close contact means that you live with or have been in settings of less than 1 meter from those who have the disease. In these cases, it is best to stay at home. However, if you live in an area with malaria or dengue fever, it is important that you do not ignore symptoms of fever. Seek medical help. When you attend a health facility, wear a mask if possible, keep at least 1 meter distant from other people, and do not touch surfaces with your hands. If it is a child who is sick, help the child. Stick to this advice. What does it mean to self-isolate? Self-isolation is an important measure taken by those who have COVID-19 symptoms to avoid infecting others in the community, including family members. Self-isolation is when a person who is experiencing fever, cough or other COVID-19 symptoms stays at home and does not go to work, school or public places. This can be voluntarily or based on his/her healthcare provider's recommendation. However, if you live in an area with malaria or dengue fever, it is important that you do not ignore symptoms of fever. Seek medical help. When you attend a health facility, wear a mask if possible, keep at least 1 meter distant from other people, and do not touch surfaces with your hands. If it is a child who is sick, help the child. Stick to this advice. What should I do if I have no symptoms, but I think I have been exposed to COVID-19? What does it mean to self-quarantine? To self-quarantine means to separate yourself from others because you have been exposed to someone with COVID-19 even though you, yourself, do not have symptoms. During self-quarantine, you monitor yourself for symptoms. The goal of the self-quarantine is to prevent transmission. Since people who become ill with COVID-19 can infect people immediately, self-quarantine can prevent some infections from happening. What is the difference between self-isolation, self-quarantine and distancing? Quarantine means restricting activities or separating people who are not ill themselves but may have been exposed to COVID-19. The goal is to prevent spread of the disease at the time when people just develop symptoms. Isolation means separating people who are ill with symptoms of COVID-19 and may be infectious to prevent the spread of the disease. Physical distancing means being physically apart. Who recommends keeping at least 1 meter distance from others? This is a general measure that everyone should take, even if they are well with no known exposure to COVID-19. Can children or adolescents catch COVID-19? Research indicates that children and adolescents are just as likely to become infected as any other age group and can spread the disease. Evidence to date suggests that children and young adults are less likely to get severe disease, but severe cases can still happen in these age groups. Children and adults should follow the same guidance on self-quarantine and self-isolation if there is a risk they have been exposed or are showing symptoms. It is particularly important that children avoid contact with older people and others who are at risk of more severe disease.